Assalamu alaikum. Have you heard the saying, prevention is better than cure? I always tell my patients that a toothpaste worth 20 dirhams is way far better than a treatment worth a lot of money. Now, for me as a dentist, to advocate good oral hygiene is there's no replacement to a good oral hygiene. Now, to all my adult patients out there, I mean, even though we keep on telling them brush properly, brush at night, I guess it all takes us to lose one tooth or two to realize how important it is for us to maintain our oral hygiene. Now, I understand for adults, this is one scenario, but what about kids? Now, even though I really educate all the parents that assist your kids when they're brushing, avoid snacks, avoid sugary drinks, avoid taking sugar so many times a day. So, I mean, we do encourage all these things, but at the end of the day, we all were kids and tend to go a bit lazy. There are going to be days they may not be able to brush properly on time. They may just drink or eat chocolate. I mean, there's no stopping them. So now where do we come and what can we do to help them? So at least give them enough time that they understand or realize the importance of oral hygiene. So the solution to this whole problem is pits and fissure sealants. Something that I've seen many parents are not aware about, and as much as difficult it is to treat kids, it's way more difficult it's for the parents to see their kids going through the treatment. So pits and fissure sealants are basically a procedure which is completely painless. So 80% of our cavities are formed because of these fissures which are there in our tooth. Now, if I talk to you, if you could see, there are lines at the back of your teeth. And usually these lines are the biggest cause that we have these cavities. In between these lines, our food gets stuck and eventually thus causing us to have cavities. Now, what can be done here is that if we close these areas properly, there won't be any food that could get stuck. Thus, there won't be any cavities. Now, the life of these fissure sealants are around 5 years, but they could be as much as 10 years as well. Thus, giving your child enough time to maintain their oral hygiene, even though they may not be able to do some days, this will at least give them time and at least protect their teeth as long as they can. So when you should give these pits and fissure sealants is as soon as your child turns 6 years old. At the age of 6, still the kids are not well aware about oral hygiene. So this is one of the treatments that you should get done as soon as your child turns 6 and you could see the tooth at the back have started to erupt. And hence at the age of 8 to 9, 2 more teeth in front they erupt. And then at the age of 12. So this is a procedure recommended for permanent teeth, not for primary. And the effectiveness is far greater. Imagine doing this treatment. It's a gift to yourself and to your kids so that they don't need to go for a painful procedure in future like a root canal or a filling, and it's gonna be a win-win situation for both the parents and the kids. Go ahead, book your appointments, and we would love to see you here, and it will be my pleasure to do pits and fissure sealants for your kids. And kindly do your research so that you yourself know how effective they are.